What if the next health breakthrough you read online is actually a dangerous myth? The Canadian Medical Association, CMA, and a coalition of health experts are sounding the alarm. Misinformation isn't just a social media annoyance. It's a growing threat to public health, policy, and even lives. But here's where it gets controversial. Many of us still turn to TikTok, Twitter, or Google before consulting a doctor. And this is the part most people miss. The line between a viral post and a life-threatening lie is blurring faster than you think. Take Chloe Cazito, a 16-year-old fact-checker and youth journalist with media smarts. Every time she scrolls through her feeds, she encounters videos claiming miracle cures or linking everyday habits to rare diseases. I see at least one video saying, "This cures everything," or "Doing X will give you Y illness," she explains. The problem? These claims are often amplified by AI-generated deepfakes that mimic celebrities or politicians, tricking audiences into believing false narratives. Cazito notes that this kind of misinformation has spiked in the last year as artificial intelligence tools become more accessible and more convincing. The CMA, alongside provincial medical groups, is urging governments, educators, and healthcare professionals to act. They argue that false health information isn't just shaping public opinion, it's directly influencing policy decisions and putting patients in harm's way. Doctors report patients rejecting proven treatments, sometimes with fatal consequences, because they've been swayed by viral content. Tim Caulfield, a public health law professor and CMA signatory, calls the situation a political minefield. He explains that health topics have become entangled with identity politics, making it harder to correct misinformation. When a belief becomes part of someone's identity, facts don't matter anymore, he says. And the stakes? Children dying from preventable diseases like measles due to vaccine hesitancy, or families draining their savings on unproven supplements, hoping for a miracle. Dr. Joseph Dahane, a Quebec ICU physician who fights misinformation on TikTok, shares a haunting example. In 2021, he treated a man with severe COVID-19 who refused hospital care, insisting the virus didn't exist. Despite Dahane's reassurances, the patient delayed treatment until it was too late. That story is the pinnacle of what misinformation can do, Dahane says. He's also seen cancer patients abandon chemotherapy for natural remedies or ignore symptoms until their conditions become untreatable. The CMA's solution? Two-pronged. Improve access to primary care, so people turn to doctors instead of social media. Caulfield suggests a toolkit: pre-bunking, teaching people to recognize misinformation before they see it, debunking myths with clear evidence, and fostering media literacy. For Cazito, the key is patience. When friends send her questionable health videos, she doesn't dismiss them. Instead, she asks, "Who posted this? What's the original source?" Media Smarts recommends a similar approach. Use fact-checkers like Snopes, trace claims to their original sources, and cross-reference with reputable outlets. If it's 2 in the morning and you're worried about something, Google shouldn't be your first reflex, Dahane warns. Call your doctor or visit an emergency room. The CMA has also clarified debunked myths. Vaccines don't cause autism. Ivermectin is useless for COVID-19, and modern vaccines are both safe and effective. Yet the battle continues. A recent Lancet study found childhood vaccination rates have stagnated or dropped globally, with misinformation driving the decline in wealthy nations. And here's the twist. Some influencers profit from spreading these myths, while doctors like Dahane educate for free. We're not selling supplements or masterclasses, he says. We're saving lives. So where do we go from here? The CMA's message is clear. Misinformation is a public health crisis. But how do you navigate this? Should social media platforms be held accountable? Is it ethical to ban harmful content, or does that risk censorship? Share your thoughts, and remember, the next time you see a miracle cure online, ask yourself, is this science or a sales pitch?